I touched on this before about the primary causes of physical and mental symptoms. So let's say a person presents to their physician with fatigue and depression, and the doctor runs the typical lab tests, which are not very comprehensive to begin with. But all of the results show that the biochemistry looks normal. There's nothing that really sticks out. A red flag doesn't come up. So the doctor's choices at that time is to say, well, maybe it's stress, maybe he needs some time to relax, maybe this is a psychological origin, but in the back of his or her mind thinking, well, there's no real lab test to prove that you have, let's say, depression. Fatigue, physical fatigue is one thing, and it's not really showing up on labs, but there's no lab test to confirm depression. So, you know, the choices are just live with it, or here is a prescription. So let's say the person does take the prescription, they're feeling a little better, their depression is a little bit lighter or less intense, but then they start having side effects from the medication because of mitochondrial dysfunction, which I mentioned earlier. So now they're thinking, well, I can't get off my med, I've tried it, I feel much, much worse now when I try to get off my medication than before taking the medication. So now they're searching, what can I do? And they find NAD. And it sounds, wow, miraculous in some respects. So they try the NAD, they stop their medication, they start doing the IV NAD, but so they had symptoms. Nobody addressed the underlying causes for those symptoms, nutritional deficiencies, environmental toxins, chronic low-grade infections, whatever it may be, stress. Nobody investigated or addressed these causes. They go to their physician, presenting with these symptoms. They're prescribed some medication, and now they're wondering if NAD will help. But what about these causes which are still remaining? NAD it's going to help them feel better because the mitochondria produce more ATP. They've got, their more energy is better. Their psychological symptoms are better, but they'll relapse in 1 to 3 months because nobody has investigated these causes. And these can be done, investigating causes can be done in a few different ways. A very extensive lab test, blood lab test. So blood is one way of diagnosing underlying causes. Certainly a good consultation with a physician to tease out the symptoms. When do you have these symptoms? When do they start? What makes them better? What makes them worse? Blood tests are going to show you blood sugar dysregulation, thyroid issues, etc. Also looking at any kind of pathogens that might be an issue. So you can do also a little tiny finger prick of blood under a dark field microscope. You can see if there's bacteria, you can see spirochetes. Everything that is a lipid or oil in the blood has a bright appearance to it. Against a dark background, which is a dark field, you can see these organisms. You can see mold in the blood. Viruses are too small to see with a dark field, but the white blood cells will have a certain appearance to them. Let's say this is a white blood cell. You can see the nucleus in the white blood cell. You can actually see, stopping down the light, you can see the activity of the white blood cell. You can see if there may be some deficiencies, primarily of vitamin C, or that the immune system is really fatigued. But with a virus, this membrane on the white cell will extend out. And this will be filled with granules, and this is going to be clear. So if I see a lot of those in a person's blood, then we start doing viral testing to see what virus it might be, even though it doesn't matter which one it is, because the therapy is pretty much the same no matter what the virus is. So my point here, again, is nobody, as far as I know, no clinic offering NAD IV therapy is investigating the causes of why the person started medication in the first place. If you're going to have the NAD be effective for a long time, maybe for the rest of a person's life, as long as they're addressing their nutrition, avoiding chemicals in their environment, and have reduced their pathogens. Pathogens usually come in, so blood is not sterile. I see bacteria, small amounts, and every person that comes to me, they've got a few bacteria at least. Some have a lot of bacteria and spirochetes and mold. So you've got to figure out, how do the mold get into the blood? Usually environmental. They breathe in the mold or the spores, and it gets into the bloodstream. The bacteria has usually been from a surgery where the skin has been broken. Even in hospital surgery, hospitals, it's not a sterile environment. Root canals, cavitations, a tonsil infection, even tonsillectomies, you've still got some bacteria in that scar tissue. Once that tonsil's been cut out, there was bacteria in that tonsil. Now you've got in the wound that seals over with scar tissue. You've got probably bacteria in the scar tissue, like a nest. There's no circulation in the scar tissue, so white cells can't get in to clean up the infection. History of appendectomy, all kinds of ways that these bacteria get into our system. And unless you address these causes, the IV NAD is not going to be long lasting.